Present with us, Deputy Secretary General, Mr. Gu Honghui, Level 1 Counselor of Municipal Health Commission of Shanghai, Madam Wu, Dean of the Shuguang Institute of University of Traditional Chinese Medicine, Mr. Fang. And first of all, the latest updates. Friends of the media, good morning. I'd like to share with you the latest updates about the containment of COVID-19 in our city. In the recent days, we have run a citywide mass testing. Yesterday, newly reported accumulated cases stood at more than 10,000 to reach 13,354. Omicron variants has been spreading very fast, and they are usually spread in a hidden manner. And today, we can see that COVID-19 is still raging in Shanghai. The situation is very urgent. In order to curb the further spread of the COVID-19 and safeguard the people living in this city, starting by yesterday, we have run nucleic acid tests. With a super large city with a population of more than 25 million people, we are racing against the clock, and we are completing a very huge task to cover all the people in this nucleic acid test. This is also a huge challenge to our capacity of running the tests. With the support of other regions and provinces, the maximum capacity of testing reached 4 million tubes, and we have also set up more than 20,000 spots for the tests, and we have also mobilized 50,000 workers to assist this testing process. In general, we have realized this task in a very smooth and orderly manner. As of 8 p.m. today, in total, we have sampled 25.6 million people. And we have already completed the testing results with more than 19.5 million. For the nucleic acid test, there are several stages. First of all is the sampling, and second is the delivery and transportation, and third is the testing, and the fourth is the report, and fifth is the reassessment and verification. We have to combine all the 5 stages and put them in a chain of link. For the samples, we have to deliver them to the laboratories in the shortest delay, and we have to make sure that all the laboratories, they are working at their best and highest efficiency. We also have to make sure that we can have this very efficient verification. So there's the quick testing, quick sampling, and quick verification. We also have the mixture testing method. So for the results, if there is an abnormal result, we have to verify the persons engaged in this mixed tube of samples and to do the individual testing. And then we have to repeat all the 5 stages of one single process. Currently, we are running the tests about those tubes of mixtures of samples that have already delivered some abnormal signs. After the verification process, we have to consider the quarantine of the people in question as our top priority. Once there is the case of abnormal signs and problems, we have to put them into the spots of quarantine according to the 9th version of diagnosis and treatment. We put the focus on the characterized treatment and diagnosis. We also apply new type of drugs as well as traditional Chinese medicine so that we can lower the mortality and also the ratio of critical cases. We have also enlarged the scale of treatment. For example, we have constructed a new batch of makeshift hospitals. The maximum of the beds available in the newly constructed hospitals reached 40,000 and more. At the same time, in different districts, we have tapped the potential of the locale. We have selected qualified hotels and stadiums, as well as the exhibition and convention centers, to build up temporary quarantine sports and the sports for the transfer of the patients. And in total, we have more than 62 of this kind. It can significantly raise the efficiency of the transfer of the patients. In order to meet the people's demand for daily necessities and to guarantee their daily life, we have launched this mechanism of emergency response for the supply of food and vegetables. We have the direct delivery to people's doorsteps. We have also set up 10 major links of the supply chain. We're in collaboration with external suppliers, 77 production bases, as well as the producing regions. Currently, for the supply of daily necessities is in general sufficient. We have to complete the task of the last kilometer to reach to the people. We are mobilizing the different sectors of our society, supermarkets, supply chains, as well as the e-commerce. They are all unified together. And we also have voluntaries working at the community level. They are forming a team of servers to our people. So if you need anything, then you have the goods delivered to your doorstep. For the elderly population living alone, we will give them more care and love. Recently, some of the citizens, they have encountered some problem in having the medical consultation, and we are solving these problems for them. We have the basic medical institutions open to the people. We also have the matching mechanism. We have also launched the obstacle-free channels so that for people suffering from chronic diseases and critical conditions, as well as the pregnant people, children, as well as people needing the dialysis, they can have timely consultation and treatment. For the people suffering from chronic diseases, we have the household doctors to help them. Taking this opportunity, I'd like to say thank you to all of our citizens living in Shanghai for your understanding and collaboration. I also would like to thank all the volunteers and workers working at the front line to safeguard the people and the city as a whole. I also would like to express our gratitude to the armed forces, the soldiers who have helped to protect our city. With the results of the nucleic acid test of this round, we will race against the clock to make an analysis about the situation and make a timely report to the public. And for this round of nucleic acid test, before you get to know the result, please just respect the rules and regulations. Unless you have an emergency, please just stay home. And together we can stay united and show our synergy against this COVID-19. Thank you very much for Mr. Gu. Now I'd like to give the floor to Madam Wu to give us the latest updates about the cases. Friends of the media, good morning. Yesterday, in our city, we have newly added 268 confirmed cases transmitted locally and 13,086 asymptomatic cases. Among the newly added confirmed cases, 14 are discovered in quarantine population, and 250 discovered through the risk population screening and testing. 4 confirmed cases that are previously categorized as asymptomatic cases. Among the newly added asymptomatic cases, 12,592 of them are discovered in the quarantine population, and 494 discovered through risk population screening and mass testing. As to the newly added confirmed 268 cases, we have 140 female cases and 128 male cases in Pudong, new area, 205 in Minhang, 11. Yangpu has 10 cases, Huangpu has 8, Xuhui has 8, Songjiang District has 6, Hongkou District has 5, Putuo District has 4, Jiading has 4, Fengxian has 2, Changning has 1, Jing'an has 1, Baoshan has 1, Jingshan has 1, Qingpu has 1. The above-mentioned 268 confirmed cases, they are diagnosed after the group consultation And also based on the epidemiological record, clinical symptoms and lab test results and imaging results, all the 268 cases are diagnosed as mild confirmed cases. As to the 13,086 asymptomatic cases newly added, you can have more details through the Shanghai release public account. For those newly added asymptomatic cases, they are verified by the authority as the positive result of nucleic acid test in asymptomatic cases. As of 9 a.m. today, in total we have covered close contacts in Shanghai 110,000 and more. All of them are put under quarantine and control, among which 100,000 have delivered negative nucleic acid tests. The others are still underway. And we have also checked the close contacts. Of the close contacts, 110,000, they're also under control, among which 108,000 have a negative nucleic acid test. For the rest samples, we are doing the tests. For yesterday, throughout the city, we have run another round of the mass testing just now. Mr. Gu has talked about it in details. It can help us to cut the spreading chain of the virus. It's a very efficient and important way of working, and currently Shanghai has entered into the most critical moment of COVID-19 containment. We have to apply this policy of dynamic zeroing, and we have to accelerate the nucleic acid test to cover all the people that need a testing. For the people that are qualified for the quarantine, we have to put them in the quarantine spaces so that we can realize as soon as possible this dynamic zeroing target of our society. Thank you very much, Madam Wu. And now the floor is open for your questions. Please first identify yourselves before raising a question. Thank you. Line number 1, please. Thank you very much. I'm from People's Daily. I have a question for Mr. Gu. We heard the news on the web that all the enterprises in Shanghai, they have suspended their delivery and businesses, excluding those who have the pass. Is that true? Thank you very much. It is very clear in Shanghai that during this lockdown period, for the enterprises in the lockdown areas, the vehicles and production materials applied by the workers, they will only be used within this closed-off areas. While respecting the rules of COVID-19 containment, it is allowed for them to continue with the production, because we would like to guarantee the supply of basic needs of the people, like the transportation, environmental maintenance, as well as the gas, oil, water, etc. All these chains, they are in normal operation. As for the pass, for the guarantee of the necessities, transportation of the people, as well as the emergency settlement, with the certification of upper authorities, those means of transport could run in a normal manner. Currently, we have already issued temporary pass in a certain number, and they are in normal utilization. Thank you. Next question, please. Line number 13, please. Thank you. I'm with Shanghai People's Radio. We noticed that recently citizens, they have received some traditional Chinese medicine just for the purpose of prevention. Could you please give us more details, Mr. Fang? Thank you very much for this question. We can say it for sure that traditional Chinese medicine has played a very important role in this round of COVID-19 containment. In Shanghai, for the confirmed cases and also cases with positive nucleic acid test results, we have 98% of utilization ratio of TCM in the designated hospitals and institutions according to the 9th version of the treatment and diagnosis work guidebook, we have applied TCM, and we have also combined with the other medicines. According to the clinical results, TCM can help to curb the further spreading of COVID-19 virus and also to accelerate the discharge rate. We have already mobilized several teams of TCM doctors. They are now doing their work at quarantine spots and also designated hospitals. Those traditional Chinese doctors, they are working very efficiently, and also the traditional Chinese medicine are very popular among the patients. We know that the variant of Omicron, they're spreading very fast, so TCM can help us to curb that rising ratio of mortality and also the critical cases. According to the studies, TCM can lower the possibility of the development from mild cases and medium cases into critical cases. It can also help to improve the capacity of mild cases to be recovered. We also have to stick to the methodology of early discovery and early treatment, and TCM can help us to minimize the symptoms. And for the ordinary people as well as the high-risk population at this critical moment, if they can take some traditional Chinese medicine for the purpose of prevention, it can help a lot. In the beginning of March, Municipal Health Commission of Shanghai and the Administration of Shanghai for the traditional Chinese medicine, they have published the 2022 risk populations intake of traditional Chinese medicine in spring for the quarantine area as well as for the lockdown areas at community level and also the district level. We have delivered traditional Chinese medicine as a precaution against COVID-19. And now we are also covering the whole city. In total, we have distributed towards the district level with a total units of 21 million. It has significantly helped people to increase their immune system. We have also added acupuncture and the other methods of treatment from the traditional Chinese medicine. It is also highly recommended to the people now practicing the quarantine at home to do the traditional Chinese boards and to have a very good routine of their daily life and take some traditional Chinese medicine just for the purpose of precaution. So with the medicine and non-medicine methods, they can strengthen their immunity and stay fit. We have developed different versions of the traditional Chinese medicine. You can also consult your doctor in order to have the best version for you. Last question for today. Line number 9, please. Thank you very much. I'm from CNS. Currently, for the designated hospitals and makeshift hospitals, among all the positive cases, some of them are already discharged. I have a question for you. What about the follow-up observation on these discharged patients, and how can we deal with their personal belongings? Thank you very much for this question. This is a question of wide concern from the public. From the makeshift hospital of the World Expo Exhibition and Convention Center, we have discharged the first batch of cured patients on the 3rd of April, and they have received a lot of best wishes from the netizens. According to our guidebook, and also based on the national version of treatment and diagnosis, we have published a series of principles about their follow-up observation before the dischargement for the personal belongings and external environment. We have carried out very strict disinfection for their clothes, personal belongings, luggages, as well as the other stuff carried by the patients. We have carried out a thorough disinfection for the temporary utensils as well as the other wastes from the daily life, we consider them as the medical waste. And when they are transferred back to their household, they have to follow a very strict process of observation. All these steps will be followed in a very smooth and orderly manner, and we are also doing that according to the national level instruction. That is all for today's Q&A session. We will also brief you the latest updates about the further policies. If you have more questions to ask, please contact our office. That is all for today's press conference. Thank you.